that took time out of their day to join us here today. It's very appreciative, and it's a great opportunity for everyone to hear feedback from families and for you to be able to ask questions on this whole process that's going on right now. Um, so I think the first thing we're going to do is we're going to do some introductions. First off, we have some DHS staff here today, as well as a member of the Acumen staff. And then we also have members of the A&M team as well, from Alvarez and Marsal. So I guess for families and other providers out there, if you could please, if you feel comfortable, please write your first name, town, and your role in the chat. So for example, myself, it would be Cade, peer, and then DHS staff. But first off, we will kind of do some DHS introductions. So I'm Kate Anderson, HCBS Operations Manager at the Division of Developmental Disabilities, based out of Pierre. And so then I guess we'll just kind of popcorn it around. So I will kind of go to Julie Hand after that.
Hi, everyone. My name is Julie Hand. I am the Assistant Director with the Division of Developmental Disabilities. I live in Pierre. I think I did that out of order, but that's okay.
And then I think we also have Augusta Weiss should be on the line. And if Augusta's not, I know Carrie Geppert's there, so.
I almost said good morning, everyone, but it's afternoon. Carrie Geppert, I'm from Sioux Falls, and I am the Family Advocacy Coordinator for the Division of Developmental Disabilities.
All right. And I know Shawnee's trying to be pretty anonymous on this one, but Shawnee, if you want to just do a brief introduction, that'd be great.
We're happy to. Hi, everyone. Shawnee Rechtenbaugh, Department of Human Services, just listening into this discussion as well. Thanks, Cade.
Thanks, Shawnee. And if there's any state staff I missed, just kind of jump in there. If not, I know we have our team from Alvarez and Marsal here as well, and if they could introduce themselves, that would be great.
Hi, everyone. I'm Alicia. Like Kate said, I work for a company called Alvarez and Marsal. We tend to partner with state government agencies when they need a little bit of extra support. So today we'll be here to potentially answer questions that you have specifically for us. And otherwise, we'll just be doing some background work, taking notes, and helping everyone from the state keep on top of things. So hi, it's nice to meet you all.
All right. Thanks, Alicia. And then I know we also have a couple other members from Alvarez and Marsal as well. So kind of, I guess the next step on this and kind of the purpose behind this is to share information with you about the changes that are coming to the Agency with Choice program. So we'll be sharing the choices that are, kind of available today. And then we'll also be sharing kind of what we're working on to create new choices. And so we really want to hear your questions and any ideas that you may have. We definitely want to hear those. And then we'll also be sharing on how you can learn more and then how you can partner with us going forward. So our goal is to really minimize the disruption for people with intellectual and developmental disabilities and their families. And we really want to achieve that by providing stable and reliable services that meet people's assessed needs. So I don't know if I can have a member of Alvarez and Marsal share the slideshow or slide deck.
We're happy to do that, Kate, but either you or Julie need to switch the host setting quickly.
I made okay. Ben a co-host.
Okay.
Hoping that would help. Ben, did that seem to do the trick? And if not, I will try something different.
I just clicked on make multiple hosts and maybe that'll fix it.
Oh, okay. Thank you, Carrie.
Ben, if you're able, you can pull up the deck.
Here we go.
Can everybody see this?
Almost. There we go.
Yes.
All
Thank
right,
you.
there it is.
Great.
Nice.
And Ben, if you would go on to, I believe it's slide 3 now. Perfect. So I think one of the first things we really kind of need to make clear is what's actually changing. So agency with choice is one way that people that are receiving Family Support 360 services manage their supports. And so we just want to make sure the agency with choice program is changing in 2024. So we just really want to make that really clear that change is coming. So I guess one of the big questions you're going to really want to ask is like, does this affect your family? So there's a couple key things here. So number one, if you or a family member use respite care, companion care, personal care, or supported employment through the Family Support 360 program, and you are not using Acumen to self-direct your services, this is likely going to affect your family. And I just want to make that really clear that, if you are a family, you or a family member are using these services, it is going to impact you. So kind of to go with that is like, what exactly is the change? So all 5 providers that offer agency with choice have told DHS that they will stop providing these services. These providers are planning to stop their co-employer services, not other services that they might deliver. So this won't affect your Medicaid. It won't affect service coordination. It's only going to affect the respite care, companion care, personal care, and supported employment service lines. So what exactly is the state doing? So there's a couple different ways we're exploring solutions to this. So one of them is looking for a new South Dakota vendor. We're also exploring national vendors as well. And then we're trying to provide additional support for current providers. And we're really trying to share that information as it becomes available as soon as we can. So another thing to keep in mind is when will your agency stop agency with choice? So the soonest one that's coming up is LifeQuest, which is scheduled to stop on June 30th of 2024. Then it kind of goes to Dakota Milestones on December 1st of 2024. And then there's a couple of them, Volunteers of America, Lifescape, and some individuals at Center for Independence will be ending theirs on 12/31 of 2024. The majority of the Center for Independence individuals aren't ending until 5/31 of 2025, but there are a few that end December 31st. So we really just want to make it clear that we're working really hard to prevent a disruption. It could occur. So people who use agency with choice may not be able to keep accessing this support, and families should really start planning now. We really don't want to see families wait till the very last minute to try to make a change to the common law or Acumen or with Acumen, because that process can take a couple of weeks. So we really want families to start planning now on what those next steps are going to be. So some of the things that we are trying, and our goal is really to minimize disruptions for people we support and their families. So some of the things that we're currently doing is we're talking to our current agency with choice providers and looking for options together. We're also talking with potential new local, South Dakota provider for agency with choice. We're meeting with national agency with choice providers as well. And these are all things that we're really trying to get done as quickly and as timely as we possibly can. Some other options that we're also exploring is whether shared living may be right for some families who use agency with choice today. Expanding and extending our contract with Acumen for common law self-direction. Sharing information about common law. This is currently the safest option to avoid a disruption in services, because there's no guarantee that there will be an agency with choice provider come June 31st that will step in to fulfill that role. So we're also partnering with South Dakota Supporting Families Community of Practice to help families plan for summer. We do know that is a very busy time for those those self-directed services such as respite care and companion care. So it really is on our radar to try to find a solution for those summertime hours. We're starting a new work group to partner with families and providers on solutions. And there will be more information on that work group further along in the slides. And then we're just kind of going to pause here to see if there's any ideas that you have, so other options that we could try to explore. And it's okay if you just want to put it in the chat too, that's a really good option as well. And one thing we will be doing too is we'll be continuing to, gather your guys' questions. And we do have where you can find the answers to a lot of those questions a little bit further in the slides. But we do appreciate your feedback and any questions that you might have. Okay. Well, if you guys think of questions, please just, let us know, put them in the chat. And we'll also open it up at the end if you have any questions, if you think about anything from here until then. So just giving everyone a little bit more information about the common law option for self-direction. So people receiving supports and their families can work with Acumen to self-direct their family support 360 services. So kind of just a little bit more background on employer of record or common law. When a participant or family member or other chosen person acts as the employer of record, it's called common law. And the company providing that service right now is called Acumen. An employer of record has responsibilities such as completing registration paperwork with Acumen and tracking the time that the employee worked. In common law, you cannot be the employer and employee at the same time. If you want to be the employee, you would need to find someone else to be the employer of record. This could be a family member or a family friend. While we're working hard to find new options, this is currently the safest option to avoid disruption in services. So just a little bit more on Acumen. Acumen does provide support to people who choose common law. Acumen helps people file taxes, take care of other paperwork, and provides tools to help employers and employees track time worked. Both employers of record and employees must enroll with Acumen to use common law. Acumen provides the enrollment packets with all the documentation that you'll need to complete. There are also some helpful videos online that provide information about how the enrollment works. And if you are interested in Acumen, a really good starting point for you would be to reach out to your family support coordinator. They can help you fill out that kind of initial template to send on to Acumen to kind of really get your Acumen enrollment process started.
Kate, I don't know, there are a couple, if you want to kind of wrap through, roll up the common law section, I did see a couple of questions come into the chat when you get a minute.
Okay. Oh, okay. So one of the questions that's kind of asked that I see from Bridget is, has there been anything new that's happened in the search for a new vendor since the last town halls? We are still having conversations. I can't really give you a firm update right now, but the conversations are continuing. We're exploring other options. So I don't really have anything firm right at this point. So what does it mean to be an employer of record? So common law self-direction gives you a lot of choice, but it can be a lot of work and responsibility. You are the employer of the workers you hire, and you also manage your own budget. So there's just a lot more responsibility kind of in that role. So when you self-direct, you are the employer of record. That means you're going to have some certain responsibilities. And so these can include developing your self-directed budget that fits with your fits within your approved individual budget, making sure you're not spending more than your budget allows, recruit, hiring, and training of workers, determining your workers' wage, developing your workers' schedules and managing timesheets, supervising and evaluating performance of your workers. There is also the possibility you may have to fire a worker if they are not doing a very good job. Making sure that you have an emergency backup plan. This plan will help if a worker you hired cannot be there when you need them to be. And then also reporting any incidents of abuse, neglect, or exploitation. And then also keeping records that you are required to keep in a safe and secure place. So a couple more questions have kind of came in. And if we can't answer your question today, we will give you some directions on where you will be able to locate answers that we have received today. So here's one from chat. If I am the employer, can my husband still be an employee to provide respite care for our son? Yes, your husband could still be the employee to provide respite care to your son. So you would be the employer of record and your husband would be an employee. So yes, in that
Parents-
situation, it could work.
Cade, parents can't be respite care providers, I don't think. Companion care and personal
Companion
care,
care, personal care, it would work.
but not respite care.
No, for respite care, it wouldn't be able to be a family member or like mom or dad, but it could be, if you had a brother or sister, those options could work then. Next question in here is, can you explain how shared living could be used in place of family support 360? So in certain situations, so shared living is first off is a service offered through the choices waiver. So that you would be required to switch from family support 360 to the choices waiver. And that is a service line that's offered through the choices waiver. We will be having some more information on shared living as well. There are some guides on our website that kind of go in a little bit more depth on what that might look like. So then, other than talk about acumen, this is all vague communication. What are the specific options you are looking at a solution? What are the deadlines for options and decisions? So I think one of the biggest things is we are really trying to find solutions right now. We are meeting with other agency with choice providers. We are in conversations with an agency with choice provider within the state. So we are looking, and these solutions are viable solutions. The thing that we keep reminding you is these solutions might not be in place come June 31st. So if that's, we are really looking at acumen as being, that option if the things are not in place by June 31st. But we are really working hard to, find a different agency with choice provider. So one of my concerns with common law option is the liability issue. Can anyone who is already on the plan give details of what kind of insurance policy they have and approximate cost? Is there anyone on the meeting that has this back kind of information that could assist with Tina's question?
Hi, so I can share a little bit of background, I guess, and just say that typically with a common law setup, an individual would still receive some amount of payroll documentation, like employee management support from some sort of provider agencies. They're typically called financial management services, or FMS for short. And it is not unheard of for that FMS agency to sometimes have a like workers' comp liability type structure in place that individuals using a common law option could then take advantage of in the event that something like that happened. It's not always in place, and it's not a guarantee, but that is something that works in other states. And so it's not the individual themselves who become liable or responsible for insurance.
And I can just try and confirm from an Acumen perspective, we do have workers' comp insurance, so all of the employees would be covered. And so from a liability perspective and insurance perspective, employees are going to be covered. You know, heaven forbid if there's ever an injury in the workplace, you know, workers' comp will cover that as part of the entire Acumen process.
Kate, I was also going to mention that, you know, related to some of the shared living questions, Gus was able to connect shortly after the meeting started. So if it would be helpful for her to talk a little bit more in detail about shared living, I see that there are a couple other questions have popped into the chat about that.
Yeah, absolutely. Gus, did you have a little bit to share with the folks on shared living?
Yes, so to answer one of the questions I see on here, an individual does have to be 21 in order to be approved or to be able to receive authorization for shared living. And so just kind of a general overview, as Cade mentioned, shared living is a residential service option within the choices waiver. And so kind of an overview of the way that it works is that there is a standardized per diem or a daily stipend for a minimum of 10 hours of services received per day. And so, you know, we have identified people, and, you know, it would be a good thing to look at people who are needing or receiving over, you know, 10 hours of services within a day to be somebody that, you know, shared living might work for your family. And so an identified provider, whether it's a parent or a community member, is the shared living provider. And they would be responsible for participating with that participant to meet their goals that were identified by their ISP team residentially. Another thing that goes along with being on the choices waiver is that that participant would also have access to other services identified in that. So if they had goals that a day service or a community day service would be appropriate, they could receive those services through one of our CSPs. If they had employment goals, they could also receive additional services for employment supports through the choices waiver. And so while shared living is kind of specific to their residential needs, there are also supports and services in place for any of their other goals that they have related to those other areas. So that's kind of a general overview, and I'm certainly available to have more specific conversations. You know, I know that each situation looks a little bit different, but that's kind of what it would look like in terms of a comparison of how family support works.
Thanks, Gus. I was just going to add also that there are some differences in the array of services available through choices and family support. So for example, choices does not offer respite care as a waiver service, or, you know, environmental modifications, vehicle modifications. So those are some of the things that are not offered through the choices waiver. So just want to make that clear, that while shared living certainly might, you know, it might be a good option for some families, it may not, you know, there's a trade-off there. So we want to make sure that everyone understands that.
Okay. So I think most of the questions in chat have been answered at this point. We did have a couple clarifying questions on if a parent could be the care provider in her personal care. And that wouldn't be until after the age of 18. And then the next question was just clarification on if parents could be the respite care providers if they chose common law. And that was just a further clarification that parents would not be able to be respite care providers if they are the primary caretakers. So kind of in the next question is, can we continue on family support if we choose shared living, or will we have to move to the choices waiver? You would have to move to the choices waiver for shared living. You could not remain on family support 360 and receive shared living at the same time.
Hey, Cade, while there's a quick lull, I was just gonna jump in and back up to a question that BJ Curtis had put in the chat. Wanting, is there any more specific options you're looking at as a solution? And are there any deadlines for options and decisions? So I thought maybe I could say a little more about that. And thanks for your question, BJ. This is difficult, obviously, trying to strike the balance between what we know and what we're working on, and not getting ahead of any answers we have yet. But so as Cade mentioned, and you're seeing here on the slide, we are specifically talking to a South Dakota vendor to see if they would be interested and able to provide agency with choice in South Dakota. So that is happening presently and has been happening for the past couple weeks, multiple conversations there. We expect to have an answer back from that company within probably about the next week. So I think we'll know if we can continue to move forward in that conversation or if that door is then closed. And then, as Cade mentioned too, we're also talking with some national agencies. So there are vendors or companies around the country that provide either common law or agency with choice around the country. And so with the support of Alvarez and Marcel, we are having conversations with a handful of national vendors who provide this service already, at least in a few other states, and or are interested in possibly pursuing agency with choice. So maybe they provide common law, but they don't do agency with choice. There are some that do both. So we really are looking at any option available. And of course, a vendor that provides agency with choice already in another state and knows about it and how it works would be an easier option than a company that maybe hasn't done agency with choice yet, but they do common law. So those are all of that to say, those are all options on the table, and we're exploring all of these at once. So I don't want you to think this slide, for example, is linear and that we're going one at a time. We absolutely are not. We're actually doing all of these at the exact same time so that anytime we get movement on any one of those options, we can put it in place with the idea that there won't likely be just one answer there. And hopefully then we will have multiple options for you to pick from. So I hope that provides some clarity, and if there's further clarity needed or something more I can say, you can pop it in the chat.
All right, thanks for that comment, Shawnee, and some clarification on BJ's question. So we had a couple more questions kind of pop up here. So what is the process to move to the choices waiver, and what is the timeline for this to happen? So for that next piece of that would be to reach out to you. First off, I would probably have a conversation with your family support coordinator. They can coordinate a lot of that transfer. And then the next part of that would be reaching out to Dakota at Home, our option 2, which would get you to DD's intake system. And and timeline. If all the information is there, it can go relatively quickly. Our times are improving as the front door's been up. I couldn't give you an exact time because each application is just a little bit different. How is the budget decided if we were to move to common law? One of the things, this kind of goes also with reaching out to your family support coordinator. They are a very good resource, and they're the ones that usually help families develop their budgets. Just a comment, it looks like here from Amy Hoekstra. I believe shared living regs allow the shared living provider to pay the respite care provider of their choice up to 30 days of respite per year. They would use their daily per diem to pay the respite provider.
Yes, that is a true statement. While respite care is not a standalone identified service within Choices, there is allowance within shared living to identify a respite care provider of your choice. We do have some training expectations of that respite care provider, but it is correct that then they would, if they've received that training, then they would use their daily per diem to pay the respite care provider.
Okay, for the next question, I'm seeing is, can you share why South Dakota is losing all of our agency with choice providers? So one of the reasons is they are choosing to end their contracts. That is kind of one of the main reasons. Another part of that was Secure Act 2.0, which would require them to pay retirement benefits to employees who work over a certain number of hours.
And I'll just add on if I can a little bit, Cade. The core of this is that the 5 current agency with choice providers in the state have the right as a business to choose if they want to offer this service or not. They have made the business decision that they are not going to be agency with choice providers anymore. Upon doing that, they also notified the state that they would be ending these contracts. And then, of course, it's on the varied schedule, the dates that they decided to end their services, LifeQuest being the earliest, were picked by each of those individual businesses. So that was a decision that they had made. And so in response to that, then we are looking for an alternative so that we can continue to provide agency with choice as an option. Thankfully, we had started common law as an option in the last year and a half, but our intent was not to end agency with choice. So this again came up because the providers had decided to move away from that. And then, as Cade said, the providers had told us that the Secure 2.0 Act, which is an Internal Revenue Service, an IRS requirement, is really what fueled them to look at this as employer. There have been changes by the IRS over the last several years. You may remember when they changed to a 20-hour requirement for their employees a couple years ago. That also was in response to an IRS requirement. So that is what we have heard from the providers about it, but truly it's their individual choices providers. And then our goal is to find other providers who would be interested and willing to offer this service in South Dakota.
Yeah. Thanks for that further explanation, Shawnee. It's appreciated. So for one of the next questions that has come in is, so what happens if you do not have an agency with choice in place by June 30th for the LifeQuest people? There is the potential that they would have a service disruption. So they would not have a provider or they would not be able to pay their provider for respite care, companion care, personal care, or supported employment. So there could be a disruption where that might not be available for families. So there's a clarifying comment from Heidi. This may have been mentioned already, but I just wanted to make sure that everyone understands that for shared living, the person receiving services and the shared living provider must live under the same roof. For all choices waiver services included shared living, the person receiving services must also be at least age 21 and aged out of school district services. Thanks for those comments, Heidi. The next one is the shared living 10 hours per day stipend based on an hourly payment. Gus, do you have a answer to that one?
Yeah, so the stipend is a daily stipend, and so the 10 hours per day is a minimum of 10 hours of services provided for that to be considered a billable day. And then the stipend would be on a daily rate. And as Cade said, we can go into some depth in shared living trainings, and we'll release kind of a document with a side-by-side of what family support and shared living have to offer, and we can go into some more depth in that as well.
So if you choose common law, you're not going to be alone in that journey. And we're really trying to make that as smooth as we can for families. Your family support coordinator and can really help you understand the common law option for self-direction. We are still working with family support coordinators right now to help them understand the program better, because we know that it is new and coordinators are still adjusting to it. We are having weekly meetings with family support coordinators. We do have Acumen has started attending those meetings as well to provide answers to the family support coordinators on a real-time basis on getting those answers for them. So we're also exploring a new support called Support Broker. They are people who can help you understand the program, manage your budget, and manage your workers. We want to hear from families about what supports you think you may need and whether another person would help or maybe more to help manage that. The fiscal management service, currently Acumen, will pay your workers and help with your taxes and employer insurance. There are also family members who are enrolling and doing self-direction with Acumen now who will share their stories and want to help. I know Acumen also does have support materials on their website, training materials that can be of assistance to kind of help explain what their service really looks like. So how you can learn more. So the Division of Developmental Disabilities is working to create and distribute more resources. We are constantly evolving, constantly upgrading documents, providing guides. And so here's what's kind of currently available. These are all found. This agency with choice section is found on our website. You can get there by a quick Google search of South Dakota Division of Developmental Disabilities, and then it's under DDD highlights. And then it has an agency with choice information and updates. And kind of what you're going to find there, we have information and resources. We have recordings from the previous town halls. We have an FAQ that has been started that does answer a lot of questions that came out of the previous town hall meetings. We have more information about common law, some different comparisons, just FAQs with Acumen, an Acumen guide, and then also their training materials. And we're starting to, it's constantly evolving. We're always adding more stuff there. If there's things that families are really looking for related to these areas, we can definitely try to get those in there as well. So kind of, it looks like Nick's actually added the link to the Acumen training materials in the chat. They kind of have 3 videos of becoming an employer of record, the enrollment paperwork guide, and then the DCI portal, which is the time entry system. And there's also other additional materials there as well. But the link is in the chat for those Acumen training materials. So here's a question that kind of came in. Just to clarify, LifeQuest people are only losing the use of respite care and companion care. They are not losing their family support coordinators and other services they get, correct? So it's not specifically LifeQuest people. It's people using agency with choice. So a participant who has a LifeQuest service coordinator or a LifeQuest family support coordinator, they are not going to lose that service coordinator or other services such as specialized medical equipment or vehicle modifications, environmental accessibility. Will not lose those things. But if you have LifeQuest as your agency with choice, then you would lose the respite care, companion care, personal care, and supported employment. Will the support broker be able to assist families with being an employer of record? I have adults that don't have that person. I would kind of look to maybe A&M for information on that support broker.
Sure. So I'm not positive that I'm interpreting this question correctly. What I think you're asking is, can the support broker be the employer of record? And that would be unusual. The support broker is sort of like a family support coordinator with extra expertise in self-direction and the things that come along with it. But they wouldn't necessarily be a person who is the employer of record for someone.
All right. Next question that is kind of, oh, sorry, go ahead, Julie.
Sorry, Cade, I just want to scroll up for a minute. I had responded to a question in the chat, but I just wanted to explain it in case sometimes the written responses don't read the same to everyone. So there was a question around, if there was a disruption in services, will my family member have to reapply for services? So Cade, you touched on this just a minute ago, but no, you would not have to reapply for family support 360 services. So, those environmental modifications, vehicle modifications, therapy, specialized medical equipment, those will continue without disruption, but those 4 services, personal care, companion care, supported employment, and respite care, those are the self-directed services that are impacted by the agency with choice service being discontinued by each of these 5 providers. So you'll remain eligible for Family Support 360. It doesn't impact your Medicaid eligibility in any way. You'll be able to continue those other services. I just wanted to clarify that.
Thanks for that, Julie.
Yep.
So for the next question, if the family cannot find an employer of record, can family support coordinators take on that role of being employer of record for families if they are willing? I know this question has kind of came up a couple of different times, and I don't know what was fully decided on. This may be one that we want to take and try to answer in the FAQ. Can you share who pays for having workers' comp through Acumen? Also, at a call with Acumen last week, there was conversation about 10 to 15% pay goes to Acumen to help pay the service. Are you able to elaborate on this and how that may affect the participant's budget? Nick, are you available to kind of walk them through that just a little bit?
Yeah, certainly. So workers' comp is going to be figured in with the taxes, what we would call the employer burden. Essentially, think of, if you pay somebody $10 an hour, it's not exactly $10 an hour impact to the overall budget. It'd be more like $11.50 or, whatever that tax rate ends up being. Taxes are comprised of Social Security, Medicare, federal unemployment, state unemployment, and workers' comp. I don't have the exact rate in front of me, but we do provide what's called a show me the money worksheet that breaks down those individual taxes and lets you know that, you know, if you pay somebody $10 an hour, here's what it actually impacts your budget. If you pay them 15, here's the actual impact, right? In terms of how that's factored in and how that affects the participant's budget, all of that should be calculated with your family support coordinator. So, you know, if you have X number of dollars, they're going to translate that to, you know, if you pay your employee $15 an hour, here's roughly how many hours you can have each week. All of that calculation is figured in before you would get the hours that you're allowed to work each week or allowed to have your employees work. In terms of like if it helps pay for the service, what this helps pay for is basically taxes. We have to cover taxes, and then the workers' comp coverage. Those are the main things that the tax rate or the employer burden would cover. I'm not sure if I answered all of the question. If I didn't, let me know and I can clarify, but that's how Acumen kind of works with this. It's all kind of factored in and figured in with the budget before you start services here with Acumen.
Okay, thanks for that, Nick.
I
Is
think
there,
further
sorry, go ahead.
clarification real quick. I think that there is a little bit of confusion wrapped around this topic for families because they think that, you know, that it comes out of their the program, right? The family support program pays for all of those taxes. I think Jay's has clarified that in previous meetings. So as far as like from a family member perspective, as we're, you know, working with our coordinators to develop the rate, you know, the hourly rate and everything, the family support program is paying for those like employer costs. So that wouldn't be affected particularly to the employer, which it would be in this case with Acumen, that the employer would be essentially a family member. So I just wanted to clarify that it's the Family Support 360 program is covering that cost.
Yes, so what I am asking, and maybe I'm confused on this, is that if there's an additional percentage that needs to be counted for when the budget is being created, so that if, let's say, we set up a $15,000 budget based on rate of pay, does that budget actually need to be increased to also reflect the percentage that is paid out on these taxes?
That would need to be factored in or considered. So let's just throw some numbers out there, right? If you have a $15,000 budget, you pay somebody $15 an hour. Logic thinks that's about 1,000 hours, right? But it's not really 1,000 hours because it's 15,000 to cover $15 an hour plus the tax rate. So it would, the amount of the budget wouldn't change. It's the amount of hours available to the employees to work would change. And yeah, Carrie, you're exactly right. That doesn't come out of pocket for any of the employers or employees or anything like that. It's simply factored in with the budget. And you know, when you have a certain dollar amount, just make sure you're using the full hourly rate, which is the hourly rate plus the employer burden, and then do the calculations for how many hours you would get out of that $15,000 budget or whatever that number ends up being. I don't know. Hopefully that explains it a little bit better for you, but
That does. I don't think we've heard it in that way, so I appreciate that.
yeah.
Is there a shared living contract with the person who is living with the individual? Is this a yearly contract? CSPs are certified to offer shared living, and shared living providers have a contract with CSPs. Contracts are typically renewed annually. A CSP may be better able to address how often they renew contracts. So another comment here is family support coordinators have not been given the information just provided by Nick from Acumen. With that being said, we need to have a deeper conversation on this topic. And then the next question is go with that, is when was family support coordinators going to be informed on this? I know that's conversation that's a big reason why we've asked Acumen to start joining our, weekly agent family support coordinator meetings. It's to be able to answer some of these questions. And we can definitely see if we can have another Acumen staff attend our next one to answer some of those questions that are kind of coming up.
Would that require all the new 799s? Because budgets are based on need and they're based on kind of, you know, depending on how many weeks are left in the budget, all of that 799. So now if we're going to add this 10 or 15%, that's going to probably be all new 799s for each person that switches. And I feel like that's kind of where the state's pushing to, just because there is no other option of choice in this right now with the current situation.
Okay. You kind of broke up there just a little bit, Ashley. But like I said, we could definitely have some deeper conversation about this, what's your questions and kind of concerns that are going with this. I think definitely we can use some of the time on Thursday to kind of to delve into this just a little bit deeper.
And I'm not sure how much Acumen would be involved in, you know, developing those authorizations and spending plans and things like that. That's kind of outside of our purview, but I can at least offer advice and insight based on kind of what we've seen and how we've, you know, seen this work in other programs and states. And so at least just to be there to answer questions, you know, it's definitely something I plan on being at the one later this afternoon and on Thursday as well.
Thanks.
Has there been any more progress on potentially family support coordinators being able to see? Because I know at the last meeting we talked about, of course, now I'm not going to think, the case management guide. So we could help families with their budgets and those roles. I hear now support broker. I'm guessing that's instead of the case management guide. But I think there's just so many unknowns that this is why it's so scary for me personally as a parent of a child with a disability and a family support coordinator. So I see it on both sides, managing that budget.
Yeah, and I'm not sure that's quite the role of that support broker type service, Ashley. But I know we are working to kind of, I don't know, if you want to just, Ashley, if you could just repeat part of your question.
So I did my own research with Acumen, and there was some things that I found through that with different states. Was there's that case management guide, so the case manager can go look at budgets. And I'm not sure if it was you, Nick, or someone else, but they put that guide in the chat. But then we could help families follow their budget, which we do now with the agency of choice model. Well, right now that employee of record does that. And if that employee of record doesn't understand the guidelines, the employees could get services, potentially have to pay back those services, where if we could help with some of that and we can review some of that, there might not be as much apprehension or /risk. But as of right now, case managers cannot see that. We can maybe get a report, but we can't see it. But with the guide, we could see all of that when I go and I look at the guide with other states.
Okay. Yeah, and I know we have in conversation with Acumen to kind of find a solution to that, to allow you guys to have more access to budgets, and kind of what that could look like. We are currently working on it. I don't have an exact answer for you right now, but it is something we are working towards finding a solution for.
Thank you.
And I think just maybe to help with timing expectations here, because I know this issue has come up a lot. I think it's something that's going to be answered in the span of weeks to a month rather than 1 week from now, a firm update. I think it just takes a little bit more time, that particular issue.
And I mean, if you want a little bit more context kind of around that and around as to, I guess, why it's not just a flip of a switch and getting you guys access, every family support coordinator would need to be directly connected to their caseload in the system. And that's a very manual heavy process for Acumen currently, but additionally, the management of that caseload is also a manual kind of process. We would need to know if the caseload changes, if family support coordinators, move on to a different role, because that access would remain until we are notified otherwise. So then you kind of get into a very gray area of, HIPAA violations of seeing, the client information when you shouldn't. But then, also managing that after the fact is probably the biggest hurdle. When we have individual family support coordinators tied to individual clients, it makes it very difficult if caseloads change or if there is employee turnover. And so that's the hurdle that we're going through right now. We've explored ideas of having maybe, if we give leads, the option to view this information, or managers, in a way, versus each individual family support coordinator. So we're definitely exploring those options. Long story short, it is possible in our system for that to work. We're just exploring the right way to go about doing that.
So Nick, I have a question. Sorry. Touch on that. So I'm Southeast number 2. So instead of giving me specifically a sign-in username password, can you have it as Southeast number 2? So if I left, the password maybe just needed to be changed. Wouldn't that take care of like the HIPAA and the other challenging questions that you have? So it's directly under that caseload itself. Does that make sense?
It does. Yeah, it makes perfect sense. I feel like I may have opened a can of worms by talking about this. But there's definitely some further conversations that would need to be had. And those types of ideas are great. That's the kind of stuff that we're brainstorming as well. So any advice or insight that you can provide to us helps as well. But short answer is yes, those are the types of things that we're looking at to see if we could still give you access in some way, but maybe not direct access to each individual. But yeah, short answer is absolutely.
Right, which that makes sense because I'm a family support coordinator. So family support, like I'm supposed to be supporting a family. If I'm recommending them to switch over to Acumen and I have no access, and now they need to add in this person to add in that person, how am I supporting them in this part if I can't access that? I guess is like my biggest frustration. There's a lot of gray area and a lot of hidden gems, we'll call them, in switching to Acumen. And that's what a lot of families are expressing, at least to me personally, as their coordinator. And especially with the adults that don't have all the access that maybe somebody who's 9 that has respite, right? So I think that needs to be, maybe we could add that in Thursday to our family support meeting with you as well.
Yeah. All good thoughts and good ideas. Definitely stuff that we've thought about as well.
Yeah. Thanks for your answers, Nick, and thanks, Shauna, for contributing to that. Like I said, any question's a good question. Clarification's great. So in addition to taking money out for taxes, I assume Acumen takes a percentage for the administrative services. And then what percentage do they charge? Nick, I don't know if you can answer that one too. I'm assuming it's not.
Yeah, so
Why-
it's a good question. It's not necessarily it's a flat fee that we would take each month for each client. That's all factored in as part of the budgeting and all that kind of stuff. In terms of how you guys factor that into your budgets, that's the part that I'm not super familiar with. So I think there would probably need to be some internal discussions on your side on how that gets factored in. But yeah, I mean, there is a per member per month fee that Acumen charges, and it would come out of the budget. So I mean, in terms of how that's factored in, I'll leave that to you guys to do internally. But in terms of Acumen's fee, yes, there is a flat fee per member per month.
Okay, thanks for that, Nick. If we choose shared living and move to the choices waiver, what happens to the family support, specialized therapy, and recreational budget areas? So those particular areas are not offered through the choices waiver. There is assistive technology in some of areas that are similar. But the choices waiver does not have that specialized therapy or the recreational budget. For family support coordinators, there is a link. Heidi included a link for that Show Me the Money for figuring out budgets and including taxes and workers' comp. And Heidi has attached the link for that. Ben, can we move to the next slide, please? So in that area that we've talked about where you can find information on kind of what we're doing and these FAQs that are found on our website, we have posted the answers to the questions we heard at last month's town hall, and we'll do the same for the questions we hear today. So those will be located there. It is pretty comprehensive. It has a table of contents and kind of some general areas of questions. So it is a very valuable resource if you are having questions or you asked a question in the last town hall and we're kind of waiting on an answer. It's a great place to look for those. So kind of the next step is how do you stay engaged? So we shared some information with you. And we want to try to partner with you on, finding solutions, or if you have questions, trying to get those questions answered. One of the things is join our work group. We are creating a new work group for individuals and family members about agency with choice. If you are interested in participating, there is an email address listed there, ddd.update@state.sd.us. So if you are interested in joining that, please reach out. Another resource would be to talk to your family support coordinator. We meet weekly with family support coordinators to try to keep them as up to date as we can. We give them information about agency with choice and try and answer their questions. So that right there is your probably first resource that you have. Routinely check the website. Updates and resources will be added there. Bookmark the page and visit it frequently to stay as up to date as you can. We will, like I said, it is being updated on a continual basis, and it's a great resource to just be aware of. Next one would be check your email. DDD is sending emails to individuals and families about the changes. If we have your email, an email was sent to you on March 21st, which would have been last Thursday. If you want to receive future communications via email, you can join the listserv by signing up on the website, and the link for the listserv is included here. If you don't use email, please check with your family support coordinator. They do get a copy of the letter as well. The next one would be surveys. So there's 2 surveys, one for participants and families and one for staff and caregivers that are being sent out by email this week. So please complete a survey to share your feedback and any questions that you might have. So that is kind of the end. I think we had maybe one more piece, but if you guys have any further questions.
So are the surveys just going out to the people in that email bracket, or is that going out to family support coordinators to send to their caseloads? How is that being distributed?
It's being distributed through our listserv. It's not being sent to coordinators to distribute to families. The communication should be going to each of you, and we're trying to communicate as much as we can. So we want to make sure we're getting as direct as we can with families.
So we should probably send that link to all families to sign up, families and potential all the providers.
That would definitely be great. If the more people on it, the better, the more outreach we can have. So So kind of a question that was asked was, can family support coordinators join a work group, or is it only for families? I would definitely say some family support coordinator involvement would not be a bad thing. You guys are on kind of the front lines and really are direct contact with families, so you probably have a lot of really good input.
Hey, can you check that website? I think for the work group that I think the SD and the DS was transposed.
Yeah, I seen that. We'll get it corrected, Terry.
Okay, thank you. I just want to make sure if anybody who doesn't recognize that would be sending an email and then they can get on.
Nope. So there is a Menti poll there where you can ask anonymous questions or share feedback. You can scan the QR code for it, or go to menti.com and use the code in the lower right-hand corner. We gladly will take any feedback that anyone has. Want to hear all the questions you guys have, or things we're doing okay, and then things that we definitely need to improve on. So any feedback is good feedback.
And this is Shawnee again. In the event that you're not super technology savvy, which is where I will put myself depending on the day, and you're looking at this QR code and you're like, how in the world do I scan that? Just for those of us who don't do this all the time, all you do is just open your camera, point your camera at that little square, and it should come up with a little yellow border around it, and then you just tap on it. So you don't have to have a special app or anything. So in case somebody was wondering what to do with that.
Kate, will you send out that link?
Which one?
The one for families to get those emails, or that we need to send out. For some reason, I'm not finding that link. Okay. And it's not letting me click on it.
Yeah, we can send a link out, Ashley.
Thank you.
Hey, this is Carrie.
Yeah.
I had also put it in the chat, but us coordinators did not receive the actual letter that was actually sent out from the DDD update email. We did receive the graph on March 20th, but we didn't get the actual letter that was sent to the families. Is that something we can be added to, so when they contact us to say, we received this letter, we know exactly what letter they're referring to?
Yeah, we
And
can
we just-
definitely.
Okay.
Oh, sorry.
I was just gonna say, so we know the verbiage, and we don't have to ask them to send it to us. That would be awesome if we could just I don't know if other
Okay.
coordinators want to be added to that, but I think us at Black Hill Special Services would like to be added to it.
Okay.
I would second that, Carrie, just because the more communication that we have with our going to families, the better off we are to support our families.
Yeah, we can make sure that all the coordinators receive that.
Yep.
Thank you.
Also, I put the link to the listserv in the chat for those of you who are looking for it. So hopefully that'll get you there a little quicker, so you can share it.
Thank you.
You're welcome. Well, our questions have kind of dwindled a little bit, and we thank you for hanging in. I realize that we went a few minutes over our designated time, but we appreciate everyone spending this time with us, so we can provide some updates. You can all ask questions. We will be hosting another one tonight at 6:30 Central Time. And the third town hall this week will be at 1 p.m. Central Time on Thursday, the 28th. So feel free to join the next two if you'd like, if you're available. We'll be covering kind of the same topics, but sometimes questions pop up after you leave a meeting. So thanks again, everyone, and have a good rest of your day.
Yeah, thanks, everyone.
Thanks. Bye.